talking Safer Schools with Matthew McConaughey, and we're joined by two school superintendents who have been helped by his Greenlights Grant Initiative, Lori Barron from Evergreen, Montana, and Adam Eastwood from Leeton, Missouri. We also have two experts in education and human development, Dr. Sarah Lindstrom Johnson and Dr. Giselle Shorter. Thank you all for joining us in a very important conversation. Appreciate you being here. And Lori, let's start with you. We know you had to jump through hoops just to apply for a grant to pay for behavioral specialists in your district. You actually had to change the name of the school?
It was a process, yes, a very challenging process. And as Matthew noted earlier, this is a competition we shouldn't be in, right? All of our kids need funding, and we need supports for kids for physical, mental health, and safety across all of our schools. And we had already had a position in place. We were sharing earlier that we connect our families and students to resources they need. We know that if a student is hungry, doesn't have clothing, is afraid to go home, they really don't care about their math test. And so we were able to have a liaison in place that showed marked improvement. We had 69% improvement in academic achievement, 79% improvement in behavior, and an 82% improvement in attendance. And we want to keep that. And we didn't know how. And so through AASA, the National Superintendents Association, they connected us to the Greenlights Grant Initiative. And we applied, and we were just thrilled to receive someone. We are a small rural school, and we don't have the resources for grant writers. I write our grants. And so we got the grant written, super excited, ready to submit it, and it took us a month to even access the portals. Wow.
Wow.
The platforms were so complex, so many different websites, so many different requirements, and as you mentioned, our school is in our 121st year of operation. We have always been the Evergreen School District. We had to go to our bank and have our name changed and have it notarized and sent in so that whatever name they had in their database, they would allow us to apply. It's just been very challenging. The great news is Greenlights held our hand the whole way. We had someone, I mean, we met multiple times a week. The hours that the staff put in, commendable. And we were able to submit in the 11th and a half hour, I think. We're still waiting to hear whether or not we receive the grant so that we can keep this position that is giving those really increased outcomes for kids.
Sarah, you've written 7 grants. Which are the programs that help the most?
So of the 7 grants that I was fortunate to work with and write with Greenlights last year, all of them asked for people. Schools, as Matthew noted earlier, currently we have a ratio of 1 school mental health professional per 750 students. We also know that the majority of law enforcement that are on school campuses don't have additional training in child and human development or how to work in educational systems. And so schools are asking for resources. They're having to cobble together resources from the federal government, like this initiative, from state programs, even from local community grants, to honestly keep the positions that a lot of times they already have. And so there's a constant struggle to even keep these positions, particularly when the funding ends. And so then the trick is, I'm a prevention scientist. I have access to dozens, if not more, evidence-based programs. These have been tested the same way we test medical devices and pills, and they work to prevent aggression and bullying and support social and emotional development. But if we don't have the people in the schools to do these programs, we're never going to make any impact.
Yes. And let's talk about Greenlights Grant Initiative's return on investment. I know they gave $40,000 to 4 school districts in Missouri, and through that, the district got $1.2 million in grants, which is amazing. And Adam, your district was one of them. So what are you using some of the funds for?
Yeah, good question. So I took over at Superintendent Schools July 1st, 2023, and one of the first things we did as an administrative team was to do a student-based audit, and it became evidently clear early on in the process that we lacked behavioral and mental health supports. So we went out and targeted a behavioral specialist and a school-to-home based social worker, and we've also invested in a K-12 curriculum-based for student needs, education.
And Giselle, I know you've also emphasized how important it is for students to have a trusted adult in their lives.
Absolutely. I mean, the science tells us that the response to chronic unbuffered stress and its impact, right? Adversity doesn't just happen to young people, it happens in their brain. It impacts how they show up in schools. I mean, I see the amen choir of teachers and educators, right? One young person, two young people in a school environment that are experiencing the kind of toxic stress and unbuffered, unmitigated stress can totally change the color, the feel of a school. And so a trusted adult offers not just the ability to see young people, but to deploy resources when they need them and in the ways that they need, right? And that creates an antidote to the cortisol, right? It literally is the oxytocin overload. It's the adult that can be a difference maker in a child's life.
Well, you all are difference makers, and we really appreciate you answering those questions.